Hello, everyone. I'm Mike Falk. I'll be your host today. Let's have a moment of silence for General Powell. There's some controversy in General Powell's career, but he was very courageous. It took a lot of courage for him to stand up and endorse President Obama. Okay, when we think of the Villages Democratic Club, at least I think of Heather Rabinowitz. And after 15 years of being involved in democratic causes and the Villages Democratic Club here in the Villages, Heather stepping down. I sent a note to Amy, or I sent a note to everybody actually, and I got a note back when Heather stepped down. I got a note back from Amy. She just stated, "I'm in denial." And, you know, that pretty much says it for me and probably a lot of other people. Heather, are you online? Are you here? Okay.
Hi.
Hi, Heather. We got a little something for you.
Oh, nice. Thank you.
For your new journey, to start your new journey off. I'm sure that your journey is going to cost more than what we're collected for you, but every little bit helps, right? And good luck in the future. We're going to miss you. Heather, you're unmuted if you want to say a few words about your experience here.
I've had so much fun being a part of the Democratic Club with all the great people, everybody pitching in to help, all kinds of talent, all kinds of generosity and fervor. It's been a lot of years and it's been really fun. And it's time to take a break and do something else.
So how has it been 15 years, Heather? I know that I haven't been down here that long.
Yeah, right. But I've known you that long. I'm familiar with all the names and all the people, and people have come and gone. And it's so exciting to see spots here and there of the different pictures of people who've been here almost as long as I have. It's encouraging that people don't just drop out, come and go, but they keep working their butts off for the cause.
Yep. Well, that's true. Well, you know, we're going to miss you, and oftentimes it's not what people do, or it's not what gets done, it's what doesn't get done. And I think that that's going to be one of the consequences of you not being here with us, is that you know, who used to do that? And it was rats. That was Heather. So I think that we have your phone number unless you choose to change that. So, anyway.
To go into hiding. Well, I don't mind getting calls asking me for my opinions and advice.
Doris, do you want to say something?
Yes, I want to say that Heather has been such a big help to me. I do presentations for other groups and I've come to her for help, to her house, and she's helped me. So I really appreciated that, Heather.
Okay, thank you, Doris. Okay, well, let's, with that, as I said, good luck, Heather. We're going to miss you. I already miss you. And we will see you around the hood. Okay, Sue Dubman is a member of our Villages Democratic Club, and she's been involved in democratic politics and causes. And she acts as our legislative consultant. And from the screen, you can see Sue is a subject of an article in the Sun. And take a picture of this if you'd like to refer to it later. It might be a little bit of a kind of hard to see, but you know, you can take a picture of it and expand it to read it. But it was very nice. And what's nice about these articles is you get you learn a lot about people that you know you work with folks, and you don't realize their background and what they do and where they've been. So thanks Sue for what you do for us, and everyone who's involved, you know, who's been afflicted or knows somebody with Parkinson's. Thanks for that. We appreciate that. Okay, Barb Deeker, are you there?
Hi. Thank you, Mike. I just wanted to put in a little plug. I'm sure you've seen our flyers and information on our Democratic Dog Photo Contest, and we're nearing the last week of voting. You can still vote through the 19th at 5 p.m. We also have a leaderboard up on our website, and you can see our website right there. Most of you are familiar with SumterFLDemocrats.com, but you can go on that to vote, to see the leaderboard, see where your favorite dog may be. We have the top 25 dogs up there out of, we had 55 dogs entered. We were very, very pleased. So it's been a lot of fun. You can continue to vote if you've already voted. The polls are open. And another easy way is Dennis has been putting a nice little ad into the Buzz with a button that will take you directly there to the website. And I will ask him to put that in again this Sunday. So please, please vote for your favorite Democratic dogs, and then look forward to the calendar, which we'll be putting together with the photos on it. And that should be coming out in December for the 2022 calendar. So thank you. And while I've got the mic, yes, we are doing honey baked hams again. Hopefully, again, you saw that ad in the Buzz this past Sunday. If we could, go back, please. Thank you. This is the time for honey baked ham gift cards. And the thing to remember there with the honey baked ham cards is that you have to buy your gift card online. The easiest way to do this, rather than trying to take down this information on this very lengthy URL, is go to the Buzz. Both last Sunday, and we'll have it again on this coming Buzz. There's a button, you press the button, it takes you right to the Honey Baked Ham site to donate. You get 100%. If you buy a gift card for $100, you get the full $100 of value, yet 20% is donated to the Democratic Party. So, and also just be aware that as far as these gift cards are concerned, you might think, well, I don't have time between now and Thanksgiving to wait for them to mail me the gift card. You can get that gift card online. It will be provided to you online, or it could be mailed to you, either one. Take your pick. You can use it online. You can use it at the store. So all the information will be in the Buzz, but thank you very much for supporting that fundraiser. Thank you, Mike.
Okay, very good. Thank you, Barb. Okay, please welcome club member and licensed clinical social worker Lucille Karatzas. Lucille is a founding member of the Transition Life Consultants and has over 30 years of experience working with the elderly. This is pertinent to all of us as we deal with COVID and being a minority part in the villages. I know that we're like 25,000 out of another 75,000. So it's always seems to be we're swimming upstream. So if you're ready, Lucille, please take it away.
Okay, let's see. Here we go. Well, thank you for inviting me to speak to the group. It's a pleasure to be a part of this group. And what I'm sharing today is based on my observations and my experiences. I don't expect everybody to agree with everything I say. That's part of being alive and being part of the human race. But I'm going to give you my perspective, and hopefully you will come away from this with one or two thoughts, ideas that might be new or reinforce something that is important in your life. The world has been upside down for over 2 years. Actually, if you think about it, it's probably been closer to 5 or 6 years. But with the pandemic, we have really experienced a change that most of us have not ever experienced. It's a worldwide pandemic. It is affecting everyone in one way or another. It's something that is not within our control. It's not our fault, but it affects us. And most of us had problems of one kind or another prior to the pandemic, And so thinking about everything that is going on in our individual lives, it's important to realize that not everything is due to the pandemic, but other issues that we've had are made worse by the climate that we are living in. Next slide, please. And I'm there. So what are some of the stressors that we're all experiencing? Well, we as a society like things to be predictable, and they certainly have not been. We like clear answers. At the beginning of the pandemic, we did not have answers. The scientific community did not have answers. We were given misinformation. And so that made people feel unhinged. It made us doubt everything that we see and hear. And so for some people, they lost their ability to trust sources and general information. And so that fear of the unknown really affects us emotionally. We've experienced so many losses. You know, we know about the deaths. We know about the amount of people who've been affected by COVID. In just Sumter and Marion County, we had over 2,000 deaths. And the hospitals were full. People couldn't get a bed in the hospital. And yet people deny that this is an issue. And that boggles my imagination. But we're all dealing with these losses, the effects on family, friends, the neighborhood. In addition to deaths and illness, we've experienced a lot of issues that we were not able to be a part of. We've missed family gatherings, births, traditions, graduations, weddings. All of these things were affected and left us feeling a little bit sad, a little bit angry at times. And it's even worse when you think about so many people who are in denial of all of this. It just amplifies our emotions. Another change is our changes in routines. We like consistency. And we have not been able to have that. People who've been going to clubs, you know, social clubs, to the pool, some of these things were shut down. Fortunately, we're getting to a point where things are starting to open up a bit and people are starting to be a little bit more comfortable in social settings. So that change in routine is going to be something that won't be affecting us quite as badly, but it will take time. Social isolation is another stressor that we experience. People did not move to the villages to be isolated. They came for the social activities, for all of the amenities that we have. And we lost that for a while, and we're only slowly regaining that. Not seeing family, friends, not being able to go to the pool or club, social clubs, even trips to the grocery store. I didn't realize until I didn't go to the grocery store regularly that that was actually a social event. You know, if you had asked me prior to the pandemic, did I enjoy grocery shopping? And I still don't enjoy grocery shopping, but it was an opportunity to see neighbors and friends. And so those are losses as well. Financial difficulties. Many of us don't realize that there are a lot of people in the villages who are in dire financial straits, particularly in the older sections of the villages. People who came here many, many years ago and who outlived their savings. And surprisingly, and I learned that only through my work as a TLC, some of these people went to meetings and presentations to get some food. That might have been their meal of the day, and that was not available. So, you know, we may feel like we are the privileged and people here are doing well, but not everybody is in that same boat. And then, of course, there's the discord within our community. This is supposed to be the friendliest hometown, and many of us don't always feel that way. How much we focus on the discord is important. Being in a constant state of anger and hypervigilance is really emotionally unhealthy. So we have to pay attention to that. Next slide, please. So there are 4 areas of concern. To be emotionally healthy, we need to take care of ourselves. This is especially important during this stressful time. So we need to take care of ourselves physically. Many of us missed appointments, dentist, doctor's appointments, elective surgery, things of that nature during the pandemic. And now we have to start thinking about getting back into these things. People gained weight. They may have lost weight. They may be dealing with a lot of anger. And anger is really an emotion, a secondary emotion, and now I'm moving into the emotional aspects. But awareness of our moods, our feelings, and anger. And anger, if we wallow in it, is like drinking poison and expecting the other person to get sick. So when you're feeling angry, you're not hurting the person you're angry with. They may not even be aware that we're angry at them. But the anger eats away at us, and it can make us physically ill. So our emotional health is critically important. The spiritual aspects of our being, and I'm not talking about religion here, although people who go to synagogues, churches, mosques, of any kind of organized religion also miss that camaraderie. Thank goodness for Zoom that we were able to stay connected in some way, but it's not the same as being together in person. But when I speak of spirituality, I'm talking about the force that drives us to make sacrifices for others, for our nation and our community. And if you look around and the discord that we have in our community right now, it almost feels as though we've lost our moral compass. And that's unnerving. That's unsettling. And then the social, as I mentioned before, relationships, shared norms, and connectivity. These are all things that we miss and that are important to our emotional health. Next slide, please. So how do we adjust to change? Excuse me. Well, first of all, it's important to embrace all of our feelings. It's well known that feelings, or it should be well known, that feelings are neither right nor wrong. They are. You feel nervous, you feel anxious, you feel insecure. These are all very normal reactions following the events that we are going through. So if we use our energy trying to avoid paying attention to those feelings, that drains our energy. So acknowledge the feelings that you have. Sit with them for a moment. Evaluate them. You know, what is going on? Why am I feeling anxious? Why am I feeling nervous right now? Is it something I can do something about, or is it something that I need to put in my let it go box? So it's important to pay attention to what we say to ourselves. Our brain is always listening. And if we feed it negativity, we're going to live in that negativity. We can reframe something and help ourselves get out of that negative space. But first we have to identify what it is. We also have to redefine our expectations for ourselves and that of others. Understanding that other people are feeling stressed too right now, and they may not be able to meet our needs. There may be people in our lives that we relied on to bolster us up. They may need bolstering themselves right now. So knowing that we're all in this together and how are we going to carry on post-pandemic is important. Knowing what our priorities are, what we want to focus on. The ability to set boundaries. When you are feeling stressed, when you're feeling a little bit emotionally raw, it's okay to step back and allow yourself some space and not plow full steam ahead. We need to develop a window of tolerance for ourselves, a zone of comfort. That may mean saying no to some things. That may mean not always being the person that steps up to the plate. If you need that space and you need that time for yourself, it is okay to do that as long as you do it respectfully. Take your time as you get back to what we're going to be calling a new normal. You don't need to get back to all of the activities that you used to do. As a matter of fact, many people have told us that the COVID period has given them an opportunity to reflect on what is really important to them. And many of us, and I'm going to include myself in that category, wanted to do everything that was available. And we overscheduled. And the time away from all of this has given us time to reflect on, okay, what's really important? And what do I not want to rejoin? What do I not want to get back into the routine again? So take your time. Don't cram everything in at once. Ease back into it and do what only what feels safe for you. Next slide, please. So I want to talk a little bit about coping skills. Some skills are better than others. We all have coping skills. We've developed them through our lifetime. Some of us cope by being very busy. Some prefer to isolate. Some of us eat more when we're stressed. Some of us drink more when we're stressed. And, don't fool yourself. We have a severe alcohol problem here in the villages. The happy hour that goes on for hours is not healthy for many people. And people now have more time on their hands, and so they may have had their martini at dinner time, and then now dinner time gets pushed ahead. And so with more isolation, there's been more drinking. With more drinking, there's been more turmoil, family conflicts, etc. People wallow in their anger is another coping skill, not a healthy one. Humor is a good coping skill. And I'm going to put Chris on the spot here. I happen to be on Facebook with Chris, and I love her puns. And it puts a smile on my face whenever I read one of her puns. And one that came to mind this morning when I was thinking about this was one that she posted, that she knocks on the refrigerator door before she opens it in case there's a salad dressing. Now, it's a silly little thing, but it put a smile on my face. And sometimes we can do that for each other. I'm running a support group for caregivers of people who are seriously ill. And one of the members was saying her husband was having a really, really hard time. And she asked, what can I get you? What can I do for you? He says, I want a new body. And she said, without missing a beat, she says, I think they're on back order right now. That diffused the anger, the frustration. And then they started talking a little bit about, they may be on back order, but maybe they're stuck in the ocean on some of those cargo ships. So he's going to have to be a little bit more patient about this new body he wants. So using the coping skills that you've developed over your lifetime. And if you want to take a moment to write some of those down, or just on a piece of paper, write coping skills so that you think about that after we're done with this meeting. What are some of the good coping skills that you've developed? And what are some that you might want to think about for the future? Focusing on our strengths. Reflect back on what worked for you in the past. And now I want to share with you my toolbox. Some people in the mental health field call me the toolbox lady, because one of the things that I do when I work with clients is give them tools that they can use to work on whatever situation they're dealing with. And so during COVID times and isolation and things that are stressful, some of the tools that I'd like you to think about is, first of all, a calendar. And here we have the perfect opportunity. We're going to have a brand new calendar available for 2020 with these pictures of these cute little dogs. I can't wait to see whose dog is going to be on there and what kind of pictures they have. But many people on their calendars have only doctor's appointments, things that they have to do. And I would like to recommend that you put pleasant things on your calendar, things that you can schedule. Again, remember we talked about routines being important. Well, if you're starting to go back to the pool and you want to do that 3 days a week, put it on your calendar. Don't leave your day up to chance. If you have a schedule for the day, you're apt to be more emotionally healthy. So plan your activities, even if it's a TV show that you want to watch. I watch Project Runway every Thursday with my daughter-in-law's mother, and we text throughout the whole program. That's on my calendar because I don't want to forget to do that. It's a fun time. We're in 2 different states at opposite parts of the country, but we share a moment, an hour and a half actually. Another tool in your toolbox is deep breathing. When we're stressed, we tend to tighten up and we don't breathe as deeply. We may breathe more shallow. And so taking a deep breath brings that oxygen up to the brain. And you notice the minute I talk about taking a deep breath, I go in a zone. I automatically close my eyes, take that deep breath, and my body says thank you. You know, it gives it a little bit of a break from whatever is worrying me, whatever is stress, and allows the oxygen to help me think more clearly. Meditation is something that can be really helpful, and there are lots of apps on meditation. We actually have a few on our website, and I'll give you that information at the end of the presentation, of different things that you can do that we've recorded for you. But doing a 5-minute meditation takes you out of that stressful time. Being aware of your surroundings. When you're feeling stressed, when you're feeling discombobulated, go outside. Take a look around. I've had some of my clients purposely go outside and count the different colors of green that they see, the different shades of green, the different kinds of trees in their neighborhood, how many different flowers there are. Being with nature, even from your own front porch, is something that is healthy for your body and your brain. It's a tool you can use. If you are in the middle of an argument with someone and you need a break from that, you can say, you know what? I need a nature break before we continue this discussion. Go out, take a deep breath, look around, see what's around you. Be present in your surrounding. Limiting your exposure to news. You know, we want to be informed, and it's important to be informed, but the 24-hour news cycle is really unhealthy. Find the information from the sources you trust, get informed, and then let it be. Don't live in that constant state of perpetual anxiety. Next slide, please. Okay. Okay, we did the toolbox. So making self-care a priority. Making that a priority is not a selfish act. It is a necessity. So what can you do? What can you focus on to be emotionally more healthy right now? Pay attention to your self-care, your physical, emotional, social. Working on boundaries. You know, I'm personally working on my boundaries of not taking on more than I have the energy for. Going for walks regularly. Being grateful. These are my self-care tasks. What are yours? Make a note to pay attention to that. Find some meaning in life. You know, we need to have a purpose. Without that, we don't really live. We just exist. And I try to tell people to look for contentment rather than happiness. Happiness is elusive. We want to be content. Look at what we have. Look at the glasses half full rather than half empty. Do something that is meaningful. Within the Democratic Club, and there are lots of other opportunities. There are wonderful volunteer opportunities. Last Saturday in the pouring rain, I dropped off the non-perishables for the Democratic Club that they were collecting, I shouldn't say they, we were collecting. And there was this delightful two people, dressed in ponchos and umbrellas. I didn't have to get out of the car. And, I thought these people gave up some of their time to be able to help other people in the community. I felt good. They felt good. It's not a lot. It's not big things that make a difference in our life. It's usually the small things. And I want to share with you my concept of energy. Think about the energy that you have on any given day as something tangible that can be collected in a bucket. Okay, so if all goes well, your bucket of energy is full. Now, during stressful times, it probably doesn't start the day full. But as we go through stressful times, we need to refill our energy or conserve it. And watch out for the holes in the bottom of the bucket that are draining our energy emotionally, doing more than we're able to do, being disorganized, watching too much negative TV, waiting too long between meals. Our body doesn't know the difference between hunger and anxiety sometimes. The feelings may be the same, dehydration, similar things of that nature. So watch your emotional energy. Be careful about it. Next slide, please. What do we do about the turmoil that's all around us? I wish I had answers for that. Unfortunately, there are no easy answers. But taking care of yourself, managing your own emotional energy is really important. If we individually take care of ourselves, then collectively we will be in a better place. I think about our wellness being like a stone that's thrown into a still pond, and the ripple effect. My positive energy connects with your positive energy, that doubles it, and then we connect with other people. So it's important that we take care of what we can do and not worry so much about the whole big picture. We want to be aware of it, but what isn't within your control. And start with being kind to yourself. Check your personal environment and learn how to communicate in order to be heard. Next slide, please. So how do we communicate to be heard? Well, this little graphic shows you two choices. Confrontation versus dialogue. Which is more likely, more likely to get us what we need? More than likely, it's the dialogue. Be curious. When you are dealing with somebody who doesn't share your values, who is on the opposite end of your political spectrum, that you just don't understand, try being curious with them rather than confrontational. Can you help me understand why you're making this decision? Why are you choosing not to be vaccinated? I know you to be a bright person. How did you come about this decision? Avoid the tendency to preach all the reasons. If preaching to someone and telling them all the facts would make them understand, everybody would be vaccinated by now. People who are not vaccinated are determined, they believe why they are not doing this. And so perhaps just questioning them, asking them, where are they coming from? And allowing that to just sit with them and not forcing it. When dealing with somebody that is quite different from you and doesn't share your values, try to find something that you have in common. Start by agreeing on something. I agree that the tension is high here. What can we do about it? Just the two of us. Remember that we don't have to react to everything. Just because somebody throws a negativity out doesn't mean we have to catch it. We can walk away. We can do so respectfully. We can keep scrolling when we get negative. If you're on Talk of the Neighbors and you see all of this negativity, you don't have to respond to everything. That, again, only hurts you. Using I statements rather than you. You make me angry when you do this. Changing that to I feel frustrated when I hear blah, blah, blah. So using I statements rather than you can be really helpful. Next slide, please. And so sometimes it's hard to know what to say. And so I'm just throwing in a few statements to get you started. I understand your point of view. Again, start with a positive. However, this is the way I see it. We might say, we see things differently. Or it's okay to say, I'm uncomfortable with such and such. We were invited to a gathering, and I knew that there were people at the gathering, and it was outdoors, but I knew people were not vaccinated, and I needed my social distance from them. And so, somebody had just come back from a cruise, and she felt perfectly fine. She had been tested. She thought she was okay. And I said, I'm still uncomfortable with that. That's me. And I'm just going to respect my needs right now. And we may agree to disagree. And let's not let our different point of views harm our relationships. There are some relationships we're going to let go of. Absolutely. There are some people it's not going to work. Our values are so different that we may need a distance from them. But there are other people, family members, close friends. Let's remember what we had in common. Let's remember what we can agree on and try, to be as kind and respectful as possible. Next slide, please. If all else fails, agree to disagree. It's okay to disagree, but it is not okay to be disrespectful. And I think we have forgotten that. I really do think as a society, we have forgotten that it's okay to have differences of opinion, but it is not okay to be disrespectful. And be kind to yourself. You're going to make mistakes. You're going to fall into that trap every once in a while. Remember, you're human. Be willing to forgive yourself and to forgive others. And my last thought for you is, when you can't control, next slide, please. When you can't control what's happening, challenge yourself to control the way you respond to what's happening. That is where your power is. Next slide, please. And that is what I'm offering to you for food for thought. Again, I'm part of the TLC, Transition Life Consultants. We are about 22 retired mental health providers who miss the work we were doing, don't miss the paperwork and all of the other responsibilities. So we started this volunteer group. All of our services are free of charge. And we provide support groups, presentations, and some one-on-one counseling. And there's our phone number and information. We have a lovely website where we have more information about TLC, and we have videos that we've been posting throughout of COVID. So please check us out for more information. And I thank you for your time.
Thanks, Lucille. We go into a Q&A here now. If any of you folks want to ask questions, down in the lower right of your screen, there'll be reactions. If you get into reactions, there'll be a raise your hand, and then we can keep track of who wants to ask questions. So I know we did this in the last meeting. I know we're covering it again because if you're anything like me, I'm kind of a use it or lose it type of person. If I don't use it a lot, I forget it. So anyway, that's why we put it up there again. So
I see in the chat section that someone, Ellen, loves puns too. They brighten my day, I'll tell you. Sometimes they're not easy to get.
Thank you. Lucille, I liked so much of what you said. to make us healthy during these particularly rough political, I'm going to say, times. But my question is, when we're being respectful and we're being civil, our opposition, I'll use that word, is not. So it feels like we have a knife and they have a gun. You know, is civility going to help us in our political work? That's it. That's my question.
Okay. Well, it will help us emotionally, individually, to have the energy to put our energy where it will be useful. There are some people we are not going to be able to change. And to sink to their level, to me, is not only unhealthy, but it's not representing our point of view well. It's unfortunate. The squeaky wheel does get the grease, you know, no question about that. But I find it disheartening when people meet anger with anger. It doesn't advance our cause. I think we need to find better ways of saying the things that we stand for. By promoting what we stand for, we override some of the negativity, some of the misinformation. You know, yeah, I want to be angry too. I want to shout back, but I know it's not going to be useful. So I just don't want to give them the power. And when we engage in anger, we give them more power than they deserve. That's the best I got. Sorry.
Thank you, Lucille. Anybody else? Okay, we appreciate your time, Lucille. It's I've seen some comments here in the chat window that it was a great presentation. We appreciate it. And so thanks again, and we'll move on to the next segment.
Thank you much.
Okay, please welcome Doris Branson. Doris, a member of the National Retirees Legislative Network. And since we're all going to be enrolling in the Medicare plans, and Doris is going to be talking about the differences between Medicare and Medicare Advantage. So Doris, we'll need to unmute you, and then you can take it away.
I think I'm unmuted, aren't I?
Okay, yep, you are. Very good.
Okay.
Go for it.
The first 3 slides are a promo for the National Retirees Legislative Network. So I'm going to go through those very quickly so that I have time to talk more about the main topic. This was made by Jim Bodner, who is a lawyer, and it was approved by our board. He's one of the members of the board. He could not be available today. He's away on something. So just so you know, it was a board agreement about how we would do this. Okay, go to the next one. Okay, I guess. All right. This is just a rundown of what we do for this group. We go to Washington. We have people there that support the National Retirees Legislative Network, lobbyists. We have many people that belong to this across the United States, and it's nonpartisan. It serves retirees. You know, it's non-political. The focus is on income security and health care. You know, that's very important for the retired person. And we have a chapter here, and this has been promoted for a number of years now. So there are members living in the villages that belong to this. Next slide. Okay. There is sometimes confusion about the differences between we either call it a Medicare supplement or Medicare Medigap. That both those terms are used. Just so you understand a little bit about Medicare, there are 4 parts to the Medicare program. And it's A, which is hospitals. Again, I don't have a slide on this. I just want to review it with you. B is for doctors and outpatient, and C is for your Advantage plan, and D is for your prescriptions. So those are how it was set up. Some people are confused about where Medicare Advantage fits in this plan, but it is Part C. So it is funded by Medicare, but it is a private insurance plan. So it is taking money from Medicare. The original Medicare, as you have noted probably during this time period when you can make changes, is really not anything that can be changed during that time. It's just the Advantage plans and the Part D, which is the prescription plan. So that is one of the things that I think is important for people to understand, particularly when you are get that notice that you are going to be able to apply for Medicare at 65. And so you have 3 months before and 3 months after to select a original Medicare plan with a supplement. After that, you are pretty much locked into that, although you can change. There are like 7 or 8 different supplements you can change over time. So, okay, what are some of the differences? For example, in original Medicare, you're going to have no copays or deductibles except for your premium that you're going to have every month. Everyone, whether you're in an Advantage plan or in a original Medicare, have to pay the Part B, and that's right now it's around $148 a month. That can be more than that if you have a large income. I just noticed that that's going to go up to $170.10 next year. The reason that's going to happen is because of the new expensive drug, part of it, that is being made available for people that have Alzheimer's. Adelheim is called. But it will be offset by the increase that you will get in Social Security. But you will see a difference next year in that. So you can see that prescription drugs can have an impact on the other parts of Medicare, and they need to do something about that. But Part A has the insurance, Part B is the medical insurance. Part D, as you can see, is prescription drugs, and many people go to insurance agents or brokers to decide what they want to do. You should look at that every year, because there might be a way that you could save some money, particularly if you have a lot of prescriptions, because there are quite a few people that go on what they call the donut hole about the middle of the year or later, and then they're paying for those prescriptions. Again, the Medigap was put in place so that Medicare only pays 80% of your care, so that the Medigap pays the 20%. You do not have to go into that. You do not have to have the Part D. A and B you need to have. There's help with people with Medicaid if they can't afford the supplements. Now the Advantage plan, that Part C combines A and B, and usually Part D, but it depends which one you go into, because it varies a great deal. There's about 30 different plans now that you can go into. So make sure you pick the one. And this is where I want to tell you, it's really important to get educated, because you need to understand exactly what you're getting into when you go into a Medicare Advantage plan. First of all, it generally costs less for people because there's, they get rid of the premium part, except for Part B premium. But they also have to pay for copays and deductibles. So you never know for sure how much that's going to be every year, because you might have more problems in one year than another. For example, you might fall and break your leg. If that happens, then you're going to have a lot of copays and deductibles, because you have to go have x-rays, you have, all the things that go along with that. So insurance companies do not like to pay for those because that puts their cost up. And so they really like to have people that are healthy, and they look at it as a preventive care type of plan. So when you have injuries and things like that, it can be a problem. The other thing is there is a max amount that they will pay out in a year, and that's $7,750 for this last year. I don't know what it'll be next year, but they, after that, you're on your own for that year. You know, you have to pay your bills. So think about that. It sounds great, but if you get into something like cancer, you are going to pay, you're going to pay a lot of it yourself. So in the end, they really, you can't buy a supplement or a Medigap, when you're in the Advantage plan. You're supposed to get everything that you need. Now you have a year to switch Advantage plans when you get into them, because there are different Advantage plans. And some of the problems are you get into an Advantage plan and then you realize, well, your doctors and specialists are not in that plan. So that's why it's real important to check with your doctors to make sure that they are in the plan that you want to be in. And some of them are, some of them aren't. You might find some of them get out of it if they don't like the Advantage plan. That can happen. So then you'd have to do another Advantage plan. Again, anytime you make a change where you have a lot of health issues, you have to be underwritten, which means you have to fill out a lot of questions, and they might not accept you. There's certain things that they will not take. An example would be diabetes or congestive heart failure. Those are two that are very likely to not allow you to get into another Advantage plan. Also, if some people want to switch, they don't like the Advantage plan after 12 months and they decide they want to go over to the original Medicare. They can go over to original Medicare, but they most often cannot get into a Medigap or supplement. They just don't want to take people that are ill. The whole process is based on healthy people. So in that case, you would have to appeal. It's a long process. And I think original Medicare gives more peace of mind because you know exactly what you're going to be getting every year. You don't have to worry about what could happen if I get cancer. What could happen if I go above that $7,750 max that they have in the Advantage plans. So there's a lot of drawbacks to this. Many people say that you should have a fund set up, for your health, really, so that if something happens, you have that to fall back on. And many people don't think about that. Many people think when they get on Medicare that it's not going to cost them much. But if you have a couple and you have to pay that $170, that's $280. And other things that you're paying for, the Medigap, you could end up spending $3,000 or $4,000 a year or more on your health care. So you have to expect that that's going to be happening. So be prepared, educate yourself. People that are going to start at 65, really spend 3 to 4 months, researching this and seeing what you are going to be doing, especially if you're getting health coverage under your employer. Find out what that is and if you can make a change, because that's your Medigap many times. And that has been a problem for some people because the big companies drop their health care. So when that happens, you need to be move over into whatever it is that you want to do, and you can do that. So people depend on the brokers or the insurance agents, but they're not there to tell you what to do necessarily. You have to go in there and be an advocate for yourself so that you can say, well, I want original Medicare with a Medigap, or I want an Advantage plan, but I want an Advantage plan that has this and this in it. So that, for example, the PPOs are a much better plan than an HMO, but the percentage of people that are on HMOs is very high. Right now, we have 40% of the people that are on Advantage plans in the country. So it's growing, and it's grown a lot in the last few years because it's pushed so much because you know, people are paid more that take on those Advantage plans. I guess you noticed that the Villages Health switched over from original Medicare to Advantage plan. You can no longer go to that facility if you are the original Medicare, and that was very upsetting to people. But that's what happens when money is involved, and you know, you have to break even with things like that. I wanted to talk next about, and I think this is a very important slide. If you want to take a picture of it, I think it would be. Okay, as I had said, there's different Medicare, Medigap policies. The one that is most, a lot of people belong to, because it really, and I belong to it, it's a no worry kind of plan. As you can see, you can see any doctor. You can go to any of the vast number of hospitals and facilities. There's no referrals needed. There's no payment hassles of co-pays and out-of-pocket expenses. And once a year, you have the option to leave Medicare supplement and go in an Advantage plan without penalty or restrictions. Not the case if you have an Advantage plan. You can't go back, but you can go over if you want to. So I think that what really is important is the fact that you have to do these you have to get referrals for your doctor before you can go to the next level, which would be, you know, if you needed X-rays, MRIs, things like that. I see someone has a message, a question. Yes, that's per year, the $7,750 in the Advantage plan. So many people do not reach that at 65. You know, it has nothing to do with them. It's more likely to happen when you're older and have developed chronic diseases, where you're going to a lot of doctors, specialists. Again, with the Advantage plan, you have to be referred by your private doctor to these specialists. So if they aren't in your Advantage plan network, then you couldn't go to that doctor. So if your friends tell you, oh, I love the Advantage plan and, you know, this and that, well, they made sure when they took out an Advantage plan, their doctors were in there and their specialists that they wanted. If they didn't do that, then they're out of luck, because they're going to have to change to another Advantage plan. But the Advantage plans you can change in this October, December thing, but you can also change in January 1st to January 31st. So there is a lot of opportunity to change the Advantage plans. Again, some people get tired of all the referrals and the co-pays and the, you know, out-of-pocket expenses that they have. And when you look at it, I mean, the NRLN has evaluated this, and really it comes out about the same what you're paying in the long run for the Advantage plan as for the original Medicare. So you're not really saving a lot of money. And when you get into the, say you've been in it for 20 years, now they have, you know, something that they call the, where do I have it? Chronic special need plan, where you have to get into that then. And what's happening is they want more money from Medicare to cover that particular plan. So the insurance companies have figured this out, that they're making a lot of money. And also from the reading that I've done, they are being overpaid a lot of money. Medicare is overpaying them. So they have to get that straightened out. And they get bonuses, the Advantage plans. They are starred. And when I was talking to my broker, she said, I always go for the 5 stars to recommend people take those plans. Well, those stars are not always valid. So you have to remember that people are buying into something that might not be true. So I think that I would say that, what's the next slide? Okay, do the next slide. That map shows all the counties and I would take a picture of this, of all the counties in Florida. If you want to select a Medigap policy, you have to click on that, and there's a website at the bottom, and that'll bring up all the Medigap policies, and it'll show you the cost of each one of them, starting from the lowest amount to the highest amount. And that you'd be getting the same thing. You'd be getting G if you go into G, but you might pay less. So it's very important that you understand that there's a way for you to find out. And not all brokers are licensed for every Medigap, and you have to remember that. So you have to really research this to make sure that you're not paying more than you need to for the Medigap policies. Okay, the next one. And this is kind of hard to read, so I'm going to, and this is basically just so you can see what you would get into when you go into this map that I was talking about. On the left, they just ask you for your age and your zip code and insurance type and that kind of thing. And then the other side will just list the insurance Medigap policy insurance companies and what it might cost you for a year. So you have to really research that to make sure that you're doing the right thing. The brokers or the insurance agents you don't pay them anything. The insurance companies pay them. So of course they want to have them promote their insurance company. So it's real important that you do the education for yourself and find out what the copays and max are in Advantage plans and what hospitals and other facilities you could go to. Now, the PPO under the Advantage plan, you can travel with. So that's why I recommend it if people are snowbirds, because they have the opportunity then to go out of state without it costing them anything. In the HMOs, it's totally different, and you would really have to find out which one would give you the best plan. And none of them are free. So you have to think about that. They're not free. Okay, the next one. And again, I want to promote the National Retirees Legislative Network, and you have the zip code there. I mean, the website. And we help people. We get value messages. You'll get white sheets. New facts will be sent to you, emailed to you. We will answer any questions you have. It's really a positive force in the villages for our retiree model. And I get messages all the time about what's going on in DC, what they're doing, what types of white papers they've submitted, and that kind of and you can see your legislator report card, and you can send them an action alert, which I do, if you don't like what they're doing. So that helps a lot because it's a group that's doing this, and it makes a difference when you're in a group. So if you feel that this is an important group that you'd like to get involved in, please join, because it will help you as a retiree. Okay, next one. And that's a thank you for inviting us. I think we knew for sure if this is going to be a Zoom or not when this is put together. I know I spoke fast because I wanted to make sure there was time for questions. So I don't know if I can answer all of them. I'm not an expert on this. I certainly, there is a book that I used besides the information that I get, and that's called The 10 Costly Medicare Mistakes. So if you're interested in that, you can get it on Amazon. Again, it's by Danelle Roberts, and she is a broker. She does this for a living, helps people, set up their health care for when they are 65. I hope some of this didn't scare you, because it can be scary to make decisions at that time. Okay, who has a question? Can you hear me?
I can hear you.
Okay, what did you want to say?
All right, I'm sorry. For some reason, the video doesn't work. First of all, I want to thank you for letting everyone know that the medical insurance program is one big fraud, and a big, huge racket. And I think most people do realize that. And if they haven't been burnt yet, they will be somewhere down the road. One of the things that you did not mention was the fact that, or you didn't mention Plan F. This is the plan that we're in right now.
Okay.
And I don't think it's most people, if they haven't been in it now, they're never going to be able to get into it. But Plan F does allow you to, I mean, all the bills are paid. Almost all the bills are paid by Plan F medical supplement plan. And I know there's that Plan G. I think that is what was offered as an alternative to Plan F for the people who cannot get Plan F now. But are you familiar with Plan F, the supplemental plan, the or what you want to call the Medicare plan?
Yes. I am familiar with it to some degree. There's a Plan N too that they're putting out now. So I'm not familiar with that. And they keep changing them because I guess their clients are requesting certain things. This Plan G is what Jim Bodner, who he does a lot of helping people with their Medicare supplements, is what he recommends. That's why I went with that. Now, if F is better, I would certainly have people look into that when they're 65 and compare and see what it is that you could go onto that map that I had there and ask about Plan F and see what they, compare them. That's why you need to get educated so that you make the best decision at that time, because it's very difficult to switch plans, the Medigap plans, especially if you have a lot of developed, say, 20 years later, all these chronic or types of problems. They don't want to take you. You have to get underwritten. Sometimes they'll let you go back from the Advantage to the original because you're healthy, but it's risky, to do that. I mean, to think that that's going to happen, because a lot of people do when they get these cancers and things like that. Oh, well, I'm going to go back into the original Medigap. The Medigaps will not pay. You can go back, but you won't have a Medigap. You won't have that 20% that they're paying. And that's where I think there's a misinformation about that. We are having a meeting on the 18th of November at 2:00 in Laurel Manor for members of the NL. And so if you want to come to that, you certainly, because they're going to be going over the same topic. So if you felt like it was too much to comprehend, and it is, because it's complicated, it's very complicated. But again, people go to Shine and they go to Medicare.gov and they can get information there. But Shine does not really, they'll give you things, but they won't give you opinions. I gave my opinion. And that was the reason I joined this board, because I felt this was going in the wrong direction, with the private insurance companies. And, you get a lot of wonderful things, maybe things that you don't use, but it sounds great. It sounds great. And, they give you free lunches and stuff like that. So.
All right, cool. Okay, well, Dennis, go ahead.
Yes, hi, I'm monitoring the chat, and there is a note from Cliff Sachs. Everyone didn't see it, I'm going to read it. My understanding is that during open enrollment, you can go back to original Medicare from an Advantage plan. Also, the $7,550 is the maximum out-of-pocket that a subscriber would pay in a calendar year, not the maximum the insurer would pay in a year.
Right. I'm sorry if I said misspoke. That is what the insurance company will pay. And then after that, you would have to pay. But you can go back to the original if you're healthy. because it's the Medicaps or supplements that will not take you. So then that 20% you have to pay on your own. But most people want to go back when they have health issues and they have big bills. They do underwriting. They look at everything. They look at all your doctor's visits, all your drugs, everything. And then they decide whether they're going to take you in the supplement. And many times they won't if you have these chronic problems that cost a lot of money.
Thank you. And Larry Berman has his hand up.
Unmute. All right. Okay. Can you hear me now?
I can hear you.
Okay. Thank you very much. One of the things I wanted to point out in my previous comments was that anyone that is in Plan F right now, I think they should be advised to stay in Plan F. Don't go to the Medicare Advantage plan. Plan F is far superior to any Advantage plan. And really what the insurance companies are trying to do is get you away from Plan F. Once you're out of it, you cannot get back into it. Or if you can, it's very, very difficult. It's a difficult process. So Plan F is, if people do the research, if you have done the research, you'll find that Plan F, even though it's not cheap, it's expensive, just like all the other plans are. It is a far superior plan and pays for everything in the event of some catastrophic illnesses, or even non-catastrophic but expensive illnesses.
Right. That's what people want. They want peace of mind that everything will be covered. They don't have that with the Advantage plans. I mean, that's just not there. And I would, again, there's A, B, C, D, they keep dropping out. So you can go, they might let you go back into original Medicare with a Medigap that's very costly to you. In other words, there's a lot of copays and things like that. So, that's a possibility. But if you want the Cadillacs, you're going to have to go into G or F, where you don't have to worry if you get cancer that you are going to have to pay after a certain amount yourself. Oh, how do you find a broker? There's lots of them out there. You can just go online and put that in brokers for Medicare in Sumter County, and there'll be a ton of them that come up. I don't want to give you my broker. I don't think that would be right. And I've been with this person for a long time, so many people hook up with a broker and then they stay with them. If they trust them, they've given them good advice. Again, they're not all the insurance agents are in every insurance policy. So ask them which ones they're for. United Healthcare is a good one. That's what a lot of people go into, United Healthcare.
Okay. Thank you, Doris. We appreciate it. We appreciate your time. We appreciate the questions. And
I think there's one more hand.
I'm trying. Yes, I'm just confused. Is Medigap the same as Medicare supplement?
Yes.
They're interchangeable terms.
Yes, they are.
Thank you.
Yes. Because I think most people use the term supplement, and I'm not sure why, but if you looked at that slide that had the differences between, they called it a Medigap on there at the bottom. So I use that, and a lot of the reading that I've done uses the Medigap name. So I'm used to that now. So,
Okay. Thank you.
but you can ask, people don't ask enough questions. That's one of the problems. And it's just like going to the doctor. If you're not educated about the problems that you have, they could misdirect you, or they wouldn't understand what it is that you have. So getting a diagnosis is very difficult. There are misdiagnosis is one of the biggest problems we have in healthcare. And so get a second opinion. As a nurse, I would say that, get a second opinion if you're not sure. That's all.
Okay. Thank you, Doris. We appreciate it.
All right. Bye.
Bye now. Amy, are you there?
Mike, I am here. My share button has disappeared. I can't find it. So there were only 2 more slides left. The next one was to welcome Jeannie Hamilton of the Tri-County League of Women Voters at our next meeting on December 11th at 9:30. So she's going to be talking about Florida Senate Bill 90. And then our last slide was just a see you next month. Excited, can't wait.
Okay, very good. Thanks, everybody. We appreciate it. We had a few technical difficulties, but people couldn't get in, but we've sorted through it. And I know some people get in late, so I apologize for that. And that's how it is with Zoom. That's how it is with technology. You never seem to, when you think it's right, it'll trick you. So great. Thanks for our guests. Thanks, Doris. Thanks, Lucille. Thanks, Amy, for getting all this together, Rick and Dennis, and everyone else who contributed. I appreciate it. You have a great day. We will see you next month. And it will be Jeannie Hamilton from the Villages Tri-County League of Women Voters. Thank you very much.